Welcome to the Fieldnotes Podcast, presented by Seaworthy Functional Medicine. Seaworthy exists to help you overcome your complex health challenges so you can be fully vital. Now, here's your host, Dr. Rob Downey.
What do we need to learn about how we are our own best medicine? Today, we are so fortunate to be joined by Dr. Marissa Heisel, with a background in both as a chiropractor and a midwife, but who's devoted many years to really the fundamentals of being healthy in terms of how we are our own best medicine, with a focus on the well-being of women and children. Dr. Marissa, thanks so much for your time today.
Dr. Rob, thank you so much for inviting me.
I loved getting to look at the prep materials for today, given that my bias for a long time I guess we all learn from our patients, right? And it was humbling when I learned at one sort of twisting point in my practice or inflection point, just that I had still drifted into a focus on labs and pills, just functional medicine labs and pills. But like so many of life's hardest moments, it's probably when I got better at what I do, to just say, so now visit one, we just say, hey, you need to make a lifestyle play, and you really need to be comfortable in your own skin for lifestyle to work. And then, then testing and supplements can be helpful. So, yeah, should we start by talking about how you are your own best medicine, or like a superhero, right? Is there a little Genesis story we need to hear about how you kind of became passionate about what you do?
Probably like yours. I mean, we all learn from our patients. And I went into chiropractic practice. I graduated in 1999, and I started from a very holistic mindset. The funny thing is, I'd grown up in a medical family, and from the age of 10, I was going to be a pediatric orthopedic surgeon. Then I thought I'd be a pediatric oncologist, and I realized I'd last 6 months and be done. And it wasn't until I'd finished my first degree and I was thinking, okay, I'm going to apply to medical school, that something hit me that I didn't want to just dispense drugs and do surgery. And I have no idea where that even came from. I mean, literally a flash from God or the universe or something like that. And I started exploring chiropractic, midwifery, and naturopathy, and decided to become a chiropractor first. And a few years after I graduated, went to midwifery school as well for 5 years, bit of a glutton for punishment. But I mean, really, I've been practicing. I've been in healthcare for about 26 years now, since I graduated, and we learned so much from the people in front of us. And I was always very holistic in my mindset. I didn't just structurally adjust like most chiropractors. I was very much mind, body, spirit medicine. But what I started to see was just how much more there is to the human body and to health than we can begin to conceive of. And I love physiology and the way that the body works. Especially, you attend births and you look into the eyes of a newborn, and you know that there is so much more to life than just the physical. And it's funny because I love functional medicine. The number of times I've thought, maybe I'll go do some more training, like I need more training. And then I bring myself back to what you just said. I don't want to just be doing labs and dispensing even supplements. And so for me, it was what's behind all of that. And you are your own best medicine, for me, really, at least for me, speaks to two fundamental truths. First, that we are each our own greatest expert. We know our body's history. We know our children's patterns. We know when something feels off, even when the tests say that we're fine. The number of women who I know who have been diagnosed well, and they know that they're not, and it's an ongoing issue, and they know that they're not. And what starts to happen is that women start to distrust themselves. Well, the labs must be right, or my doctor must be right. Somebody else must be right. And we discount that inner knowing, which is highly valuable data that no external authority can access. And the other component of it for me is that we're also each our own most powerful healer. When we're willing to do the really deep inner work, when we're brave enough to do the inner work, to unravel trauma, to address toxic exposure to whatever it might be in our lives, to reconnect with our body's wisdom, we can really address root causes and prevent many health issues without becoming dependent on external interventions. And I've been challenged. Does that mean that you don't think that people should be ever seeing a medical doctor or ever taking pharmaceutical medication? And it would be completely unethical for me to say yes, because there are absolutely times where all of that is necessary. But we've become a society where that's the first stop, not the last stop. The minute your child has a mild fever, the minute you've got a cough that lasts more than a week, the minute we run to see some sort of a health professional, whether it's alternative or conventional, without trusting that our body knows what it knows, without understanding what these signals might mean, that these signals are wisdom in our body. But we've been trained to see everything as a symptom, and every symptom needs to be pathologized and medicated. And I've seen too much of it over the years.
Yeah. Yeah. Well, I just respect you so much for devoting yourself in this area. I last 5 years or so, I've thought, oh, maybe there's these really noble reasons I do such and such. And then I've realized most of what I do well for myself and others is kind of school of hard knocks type thing. And maybe that's from growing up in Montana, just sort of I'm not a cowboy. I would never claim that. I didn't grow up on a ranch, but I really wonder now if I learn the way cowboys learn, like by getting kicked in the head and falling in ditches. And so I've very much been so happy to listen to my inner voice now. And I find my, inner voice or better angels or, guiding intelligence. I mean, there's so many beautiful words or phrases we can use to characterize this. Everything is just so much easier, but also that same inner wisdom, and you'll talk to us about building our inner compass here in a minute. We do know. We know where we stand on things. We know what feels like something resonant to go toward or something that we're averse to. And I really am happy for my patients when we just talk about what's your why? What do you want? How do you feel about this? Do you like being on the treadmill? It's really shocking when they say, oh, I got to get back on the treadmill. And I say, do you like it? No, I hate it. But I was really happy when I had roller skates as a little kid.
Right.
So anyway, should we go next to inner compass? Like, how do we put this together today for people to, a lot of our audience, who I thank for joining us, they sense this, right? Or they're doing it already, or they're not doing it, and they really need to know how, because they are terrified that if they don't just run to the experts,
Right.
but at the same time, they're frustrated with the experts.
Right. Okay, so can I be perfectly honest here?
Yeah.
Okay. I see us as being a culture that has been deeply propagandized or conditioned, let's say, for generations to distrust our own body and our inner wisdom, which creates this lifelong authority, this lifelong dependency on external authority, while suppressing this innate healing intelligence, this innate wisdom that exists within every single one of us. And because most of my focus is on women's health, in fact, for years in practice, I only saw women and children, and my husband, who's also a holistic chiropractor, he got everybody else. I really see that conditioning operating really powerfully through two critical life phases of women's lives. The first is when women are pregnant and when they're having children. And of course, this harkens back to my background in midwifery and loving natural birth. But there's this real targeting of mothers and children to establish an early compliance and early dependency. This belief that you can't do it on your own or you're endangering your child right from the time a woman is pregnant, and absolutely in obstetrical birth. And then I see it strike again during midlife, particularly around menopause, when women's natural wisdom and intuition and authority would otherwise emerge most powerfully, I believe. And what starts to happen is we get this devaluing of a woman's knowing and of a woman's body and of her internal wisdom and of her capacity to heal if she's just given the assistance or the direction or the belief that she can. And of course, that is not to discount those times that we need outside assistance. But by and large, I think we've medicalized both childhood development and midlife transitions so much that the system has ensured that women remain disconnected from their sovereignty throughout their entire lives. And then we have children who grow up never learning to trust their own bodies. And that's where my work is coming in. Initially when I started Elemental Healing Arts, which is this business I'm working in now, my thought had been that I would sort of be your holistic doc next door, because I live internationally. I'm an expat myself. I would be your holistic doctor that you could turn to and do consults with and all that kind of thing if you're living abroad as well. And what I realized is that it would just be dispensing more supplements and making more recommendations. And what we really need to get to is an understanding about our own inner wisdom, our own incredible power, our capacity to heal if we choose the lifestyle aspects that are most complementary to healing and to growth and to embracing change. If we allow ourselves to explore our own mindset and recognize that it's okay to change, if we've been raised a certain way with certain beliefs around health and food, and maybe they're not so conducive to well-being, it's okay to change those, that as we know more, we can do more and do better. And so the work that I'm doing is really starting with taking away, not adding more. I think women are so inundated with programs and all the things and all the supplements and all what I try to do is to say, okay, let's look at this set of beliefs and see what we can slowly peel back and remove, so that who you are at core, your own inner knowledge, can start to shine through, and you can start to trust it, where you trust your voice first, primarily, and then you bring in that supportive healthcare around you who are willing to honor your voice and your knowing and not discount it because you don't have a degree in something. I think we need to start there with speaking wisdom into people, their own wisdom and belief in their own inner knowing. I think that's where we have to start again.
Well, I definitely thank you so much. I mean, it's worth it for folks listening today or watching, just hearing that and stopping for a moment, reflecting, feeling how that feels in the body. I think what I see when the door closes and I'm in the room with the patient or the patient and their family or the patient and their friend is akin to what you just invoked a moment ago, just what's really going on. And then it's not always convenient. It's not always easy, or sometimes it's really easy, but the person won't give themselves permission to do the easiest thing. So I think that as we talk then about people build their inner compass, just knowing one key principle is just wanting to know what's really happening.
Right. And I think part of that comes from, again, questioning everything, even us as the professionals with the degrees. I want to be questioned. Ask me, challenge me. But as an individual, I believe that we need to question everything, especially when it comes from institutions that profit from our compliance. Whether it's an educational system that demands conformity or a medical system that tends to push pharmaceuticals, I think we always need to ask who benefits from our dependence. I think we need to trust our intuition about our own health and our children's needs, and that our inner knowing is more accurate than any standardized assessment. A mother who observes her child's natural healing, natural learning patterns, natural energy levels, knows more about that child's needs than any teacher, administrator, medical doctor, social worker, anything else, who's only getting a brief snapshot in time of this child. And so when a woman says, there's something wrong, I know there's something wrong, and we disregard it, or we say, all you need to do is medicate it, or the labs are all fine, we're reinforcing this belief again that this woman doesn't know. So we're discounting her inner authority. We're not helping her build that inner compass. Like you said, that inner compass is really connected to our true north. But we're assuming then that people even know what that is for them. I don't think most people do. I think we live in a time where we are so discombobulated by work and by real negativity coming at us constantly about everything. Wars and money and education and government and this wrangling and this headbutting between people and factions. And that I don't even know if we truly know where we stand, without then attacking somebody else. Knowing who we are, truly knowing who we are, means that what somebody else has to say about what we believe or who we are, or what political party we follow or anything else is completely moot. It's a moot point because we know who we are and we stand in our own inner authority. But it's so easy to pull people astray. I mean, I'm old enough to remember when we would say sticks and stones may break my bones, but words will never hurt me. And these days, words hurt everybody. And I think it's because we don't have a strong enough sense of what our inner ethics are, our inner morals, our inner compass, our true beliefs that are unshakable. And even then, as we learn more and do our own research about health or education or whatever it might be, the way that we interact with the world might change a little bit, but who we are at core is so deeply rooted that nothing changes that. And so when somebody says, no, what you know about yourself can't possibly be correct because the lab shows X, no, I know myself deeply enough to know that we need to investigate further. I need to learn more. I need to unravel something that happened in my childhood, or I need to explore how I'm eating right now, or I need to look at the stress in my life or the relationships that I'm in or something. And
So powerful.
I don't think we do that. And I think it is powerful.
Yeah. Such elegant language, so powerful. Well, there's a couple of things we probably should do at once. One thing I've learned is to not bury the lead, and I've learned as well as the host that people are going to hear you, and then a subset of them are going to think, oh, I want to work with this person. And so let's talk about how people build that inner compass, because that seems like the logical segue.
Okay.
But also how, what's the format of how that works to work with you? Is it accessing content? Is it one-on-one? And also, yeah, I think that's the logical next step.
Sure. Where would you like me to start?
Well, I also thought maybe share some stories, because as I heard you talking, I thought this would probably be really helpful to share some anecdotes, because there's a motif here. I keep flashing on thyroid when I hear you talk. I probably, I have women in the hundreds who say, I know my TSH of 3.5 or 4 is unacceptable. My hair's falling out. I'm constipated. I don't have the lean body mass index I want. And they're so reassured when we do a 6-part thyroid panel and optimize thyroid function. And, we could go on, but I also keep flashing on just, I want to acknowledge this powerful truth that I think you're having the courage to talk about. I even very much like what you said at the beginning. Is it okay to be honest here? And I would say this wouldn't be a real. Sometimes we surprise ourselves. So when I chose Fieldnotes and an exploration of functional medicine as the name of the podcast, it was sincere. But then during these conversations, I realized it was real exploration. It was my job to create a space for people that know really important things that sometimes challenge us.
Right.
To say, hey, and really it's just a chance to keep it real. It's a respect-based platform and space for people who care, that have important information to share it.
I love that. Thank you for doing that.
Yeah. Thanks for doing what you do. So yeah, if you want to talk about inner compass, or just share a story, but also let people know at this point in the podcast, if they're going to learn about their inner compass and or become one of your success stories, I don't save it for the end anymore, what it would be like to work with the thought leader, because I think people are wondering, is it one-on-one? Is it educational content?
I love that.
So I'm starting to put that a little earlier. Yeah.
I do some one-on-one work, but I do one-on-one work with the women who have already worked with me through different programs, so that it's not coming out of left field when I say, okay, I want you to become your own best expert. Trust yourself more than you trust me or anybody else. And they're like, I can't even begin to. So let's see. Probably the best place to engage with me is with my website, which is elementalhealingarts.life. I took myself away from social media entirely in 2020 because I could not handle the toxicity and the inner wrangling that was going on. And I'm slowly building my way back with a little bit of Instagram and a little bit of And so you can access Instagram through my website. That's the best way. And what you'll find on there is right in the top half of the page is a blueprint called the Energy Elevation Blueprint that's free to download, that just has ideas about how we can lean into increasing our own energy in our lives. I do bi-weekly emails and blogs and all those kinds of things, so you can sign up for that as well. And those are all great ways to reach me. Starting in the new year, and I don't have a launch date specifically, I'm going to run a couple of longer programs. One of them is an 8-week program called Midlife Reclamation. And it's really about women finding this inner power, this inner authority again, at a time of our lives when so many women really start to feel very discounted. Things are changing in our bodies. We're not feeling great. We're not getting great advice. And if we look at the way that women in their 50s and 60s and even 70s are represented in media, it's very derogatory. And so how do we claim all of this brilliance and knowledge of the previous 50, 60, 70 years of our lives in order to stand as the wise women that we are becoming? That's what that program is. And the other one, and I still don't even know exactly how long it will be, is my first love, which is Raising Healthy Kids Naturally. And so that's the name of the program, Raising Healthy Kids Naturally. And I already know there's a book somewhere in there to do with that as well. It's like tumbling around in my head, and I need to run the program a few times, but that will be something else that's coming out in the new year. It's just a matter of exactly when. So all of that's accessible through the website.
Cool.
And then a story. Well, I'll tell you a very current story. I am not working as a midwife any longer, and I'm not really a doula. I'm sort of somewhere in between the two. I'm a very knowledgeable doula that can spot, emergencies from 1,000 paces. And I was wasn't supposed to be a home birth, but it was a woman's home in a very isolated area last week, who wanted to labor at home for as long as possible. And she labored for 13 and a half hours, and it was very clear that nothing was progressing. And so I sent her to a small regional hospital clinic right behind their house, where I assumed that she would probably get an epidural, which would allow her to rest, and hopefully she would be able to have a vaginal birth. And instead, that hospital panicked, called an ambulance that drove an hour and a half up the mountain they were on, took her an hour and a half back down this mountain over terrible roads to another larger hospital, where they immediately insisted on a C-section. And I was no longer with her. And I live in Central America. The medical staff at this hospital told the American father that he was not allowed into the operating theater, and then told him that he was not allowed to see his own child. And he was not allowed to see or hold his baby for 3 days. They claimed that's law. I don't believe it is. I think it was because he was trying to assert their rights about what they wanted for her health care and their child after birth. And I think he got a lot of pushback. What happened when the mother got home 3 days later is that she felt completely broken. And so the first thing that I did when I went to see her was to speak so much love into this woman about how she did literally everything. There is nothing that she did wrong. There is nothing more she could have done. Her body was brilliant and working so hard, and that we don't always know the reasons that some women don't dilate. And sometimes it's physical, and sometimes it's emotional, and sometimes it's past trauma. And she was like Wonder Woman. And you should have seen her eyes light up when I said that, because somebody was saying to her, "You're brilliant, and your body is brilliant, and you did everything that you could have done for yourself and this baby." And it literally changed everything in a second. And I saw it in her eyes, and so did he. And I think when we can start to do that, no matter what the outcome of a birth looks like, no matter if it goes the way you want or doesn't go the way you want. I stopped helping women with any kind of a birth plan so many years ago, because when it doesn't go the way that we want, we feel like we failed. But if we can still debrief and speak love and healing and brilliance into somebody who has just gone through, 13 and a half hours of hard labor, and then a section, and then a refusal to allow her spouse to be by her side, that woman needs to feel like she is still standing in her power when
Mhm.
she's just been through something that feels so disempowering and like failure.
Mm.
And the more that we can do that as practitioners, as friends, as family members, not point out what didn't go well, but what did, and how your body is always working for you, even when it doesn't feel like it. And no, it might not have been what you were hoping for, but you have this beautiful baby, you are healthy, and you're home again. And let's start building exactly what it is that you want to build for yourself and this child now. So
Mm.
that's just one very
Mm.
current example.
Mhm.
I've
Mm.
literally been up to see them twice since this
Mm.
baby's born. So it's still an ongoing, evolving story.
Mhm.
But it's indicative of so many things. I mean, I've seen some pretty horrendous obstetrical behavior, but to
Mhm.
refuse to allow a father to see or hold his child was a completely new one for me. And I
Mhm.
was gobsmacked by it. I mean, they had to get a lawyer involved. It was a, you know,
Mhm.
it was a bit of a mess.
Yeah.
But we can either leave it as the mess and she sits in the feeling of failure and disempowerment, or we turn it into, my God, is your body brilliant? And I'm sorry it didn't quite go the way that you wanted it to, but wow, you worked so hard and it was absolutely brilliant the way you handled that. It's a very
Mm.
different place.
Yeah.
And when you're starting off with your first child,
Mhm.
to stand in that place as a mother then gives you a very different starting point than to feel disempowered and potentially abused. And that's a very different starting point in terms of the trust that we have for ourselves as mothers and as parents. And it even allowed me to say to the father who has older children who are already grown, and this is a second marriage and a younger wife and all of those things, I said, I know you were feeling a little disconnected, but I watched you for 2 days fight tooth and nail for your wife and baby in that hospital. And that right there connected you so much to this baby. And he said, never thought about that. Thank you.
Mm. Mm. Yeah.
And so sometimes we just need to reframe things for people
Yeah.
so that they feel like they're standing in this deep inner wisdom that they can then grow from, as opposed to starting from a place of depletion where you don't know what your next step is and somebody else needs to tell you what step to take.
Mm. Love that. It reminds me of uh, I did a lot of hospice work down in Montana. So when I got to Alaska for a while, I was giving presentations to hospice volunteers here. And one time after the talk about how to show up for people when they're dying and how to show up for yourself and the importance of being present with what's happening,
Mhm.
a woman then later said that, um, hearing what people need when they're dying, what families need when they're dying, it helped her come to terms with a multi-year feeling of failure she'd had around how she showed up for somebody in her family that was dying. And so I think when we keep it real, we're really interested in who people are. We're really interested in their inner brilliance, their inner radiance. And a lot of the time here, I'm just shocked with something short of what you're doing. You're talking about resetting their narrative, resetting the trajectory or arc of their life in recognition of their power, but even just hearing them. I think the most common words at the first visit here are that it's the first time the person's been heard.
Absolutely.
So, and I didn't realize it till this minute talking with you, but that is it in itself a recognition of their inner radiance and their inner brilliance, right? Just that they're heard and respected.
Mm-hmm. Mm-hmm.
Yeah.
And how much, I mean, that's where so many people look at medical professionals, holistic health professionals as you're on some sort of a pedestal because you've gone through the training and you've got some experience. It's just training and experience. How much more empowering is it for our patients and how much more satisfying is it for us doing this work to know that you just listened and you held space for somebody to come to their own realization without imposing this top-down hierarchical, slightly aggressive, somewhat abusive.
Mm-hmm.
I mean, you see so many questions these days about why have people lost trust in the medical system? How do you not? when your own voice, your own knowing, your own wisdom is discounted so entirely. And for me, I am a holistic health professional. I have been for 26 years, plus all my training, plus all the, all the things that we do, plus my experience. So for me, this is the easy way into this. But my bigger purpose right now, my bigger goal is I see humanity standing on a knife edge. I see us standing on the edge of a cliff, on a knife edge, where we can either tip over into complete technocracy, where you are never touched by a healthcare professional, you are never acknowledged as a human being, where AI is basically doing all of the diagnosing, where medical students don't even need to take anatomy classes anymore because you can pull up Dr. Google on your phone. Or we speak truth and wisdom and belief in themselves back into people, and we remain firmly rooted in our own humanity. That to me is actually what my work is. And the way that I am accessing it is through this work that I'm doing with women's health at midlife and raising healthy kids naturally, because that's what I know and it's what I love. And I decided in my 50s that I am going to dive into what I love in the work that I do, because when we're passionate about what we do, it radiates out and people feel it and they want to be part of it. But for me, it's not just about the health piece. It's about retaining our humanity in the face of something that is very non-human, very transhuman, and it's very concerning to me.
Thank you. What can our audience do today to start to get in touch with their inner compass, their inner wisdom?
Honestly, the simplest thing is what I always go back to, which is we can breathe. We sit there and we close our eyes and we put one hand over our chest and one hand over our bellies, and we just let ourselves breathe. And we feel the inspiration and we feel the expiration, and we feel it move through our bodies. And we can ask, am I breathing into my lungs? Am I breathing into my stomach? Can I bring a little more air in here? Can I calm my mind as I'm doing it? And I'm not talking meditation, because living in a Western culture, we're not good at that. We're really not. We try and our minds are busy and we're hearing the chattering, but it's really easy to stop and bring ourselves back to our breath. A difficult day at the office, a difficult day with our kids, you can teach a 3-year-old to stop and breathe. You can. I've got a friend with a 4-year-old who is this brilliant child who goes out foraging for mushrooms with her parents, and at the age of 2.5 knew mushrooms that were safe to eat and how to tincture them, and mushrooms that were dangerous. I mean, the things that children are capable of if we just show them. But this child knows how to self-regulate at 4. And she knows to stand with her feet on the earth outside and breathe. If we can teach that to young children, we can certainly remember how to do that as adults. And the other piece of that, I will admit, is we have to get away from our devices a little bit, from the pads and the phones and the computers and the blue light and all of those things. And I always say on these podcasts that I'm not advocating a return to Little House on the Prairie, but I kind of am a little bit. Just simpler times, making real food, learning a new skill, planting herbs on your kitchen sill if you can't do it outside, something that returns us to nature, to a connection to our feet on the earth and whatever our belief is about God or the universe or the creator or something above us, and feeling like we're the channel between the two. It helps us to situate ourselves in something that's so much bigger than our day-to-day worries and our day-to-day work and our day-to-day financial woes and all of those things. And the more that we can do that and learn to self-regulate and regulate our nervous systems, which, is not a terminology that we used 26 years ago, 30 years ago when I was in school, but it is terminology that we use now. If we can learn to regulate our nervous systems, then we start to shed some of that stress and fear and propagandizing, and we begin to return to this channel within ourselves where we can always go back to our breath, always calm ourselves. And when we can do that, when we can turn off some of the noise just a little bit, we start to hear our inner wisdom just a little bit more.
That's fantastic. Absolutely fantastic. Just really happy people get to hear the resonance in your words. I think it's a really important sort of energetic node to have be, the like the last note in this discussion, because it carries so much resonance and it's so provocative, right?
And
Do
it's
that. Put your
simple.
feet on the earth. Yeah.
It's
Feel your
simple and it's
breath. Put your hand on your
free.
belly. Put your hand on your chest. Right.
Right.
Yeah.
It's free
Yeah.
and it's simple.
Yeah.
And it's not, it's not a program you need to take, a course you need to do, a supplement you need to, it's none of that. It's just, can we return to our own humanity and our own trust in ourselves, especially when that trust has been knocked about for our entire lives from the time we were children? Can we just bring ourselves back to it and keep bringing ourselves back to it so that we start to become more resonant with our own inner knowing, our own belief in ourselves, our own hearts, our own North Star. And we start to let some of that noise just go a little bit.
Yeah. Well, I'm really interested in this stuff, and it's a really good day for me to hear your message too. So
Oh, I'm glad.
Thank you.
You're welcome.
Thank you. Is there any wisdom you want to share that you didn't get a chance to?
I don't think so. I don't think so. Other than I truly believe and know after so many years of doing this work that we all are capable of this truly expansive health. No matter how, no matter what our health issues are, no matter what we're born with, no matter anything else within our own lives, I truly believe that we are capable of and entitled to, deserving of vibrant and vital health, like vitality and vibrancy in our lives and in our health. And we get to be active participants in that. We need to take radical responsibility for that, is the wording that I use.
Bravo. Well, thanks again so much.
Thank you.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.